away from losing our health care coverage and not being able to afford or buy our own. Thanks to our broken health care system, no matter how much we save and prepare for the future, we cannot be sure that our family's health care needs will be taken care of. I'm happy to be here today to talk about some of the problems that exist in our current system and encourage a solution to a public health insurance option. Given my profession, I speak to many people about our health care system. Most people tell me they feel we need health care reform in this country. A public health insurance option will play a key role in health insurance reform. As someone who makes a living from private health insurance, I welcome the competition from a public plan. With a public plan in place, if I cannot find a private health insurance company that meets a client's needs, I will know that the client has another option when they walk out of my office. They will have a choice of affordable quality health care, public or private. Thank you.
Tiffany Nias is a student intern for the Virginia Organizing Project and has been knocking on doors all over Hampton Roads, talking to members of the community about health care.
My name is Tiffany Nias, and I am a senior at Lynchburg College. I am currently an intern with the Virginia Organizing Project. This summer, I am community organizing on several issues in Hampton Roads, the main one being healthcare. I am glad to be doing work around healthcare because it is an important issue for me. I've not had healthcare for most of my life. I have only had coverage for the last few years and will likely go without it again. My sister and other members of my family have never had healthcare until recently. I've seen what it is like to be uninsured with my own family, and it is a big reason why I am out in the community working on this issue. It becomes clear to me every day that we need to change the way our healthcare system works. Every day I'm out in the community, going door to door, talking to people in the community about healthcare. Most of the people that I talk to would like to see healthcare reform soon. I speak to a lot of people in the military in the area who have excellent health insurance through the military. Yet even though they are covered, they usually have friends or relatives that are not. They are aware that the system is broken and that they are lucky to have good coverage. Very few people are completely unaware of our broken healthcare system. I spoke to a woman in Virginia Beach yesterday who was very ill with stomach sick. She has racked up over $500,000 in medical debt. She was very worried about her debt, and she recently sold her house to pay off her debt. She made $200,000 for her house, but still has over $250,000 left to pay. Not only does she not have insurance in her own illness, her 7-year-old daughter was just denied Medicare. She wants to know that her daughter is taken care of. After sharing her story, the first thing she asked me about was a public health care plan. She wants to see a public health insurance plan as soon as possible. As a single parent, she really needs affordable coverage. She cannot get health insurance through her job. She is working hard but cannot afford to buy her own health insurance because of her pre-existing conditions that exclude her from all but the least affordable options. She hopes for her illness to get better and avoids going to the emergency room so that she does not increase her debt. Unfortunately, these stories are fairly common out in the community. I hear them all the time. It saddens me that people who work hard cannot afford basic necessities like health care. The only positive aspect of hearing these stories every day is that people are fed up and ready for a change. Most of the people I speak with know that our health care system is broken and want to see it fixed. I would like to see our health care system fixed so that I can not only continue to have my health insurance, but my family members and friends have health insurance as well. Thank you.
The last speaker is Donna Sequeira. Donna?
Hello, my name is Donna Sequeira. I'm a volunteer for the Virginia Organizing Project, and I'm building my own spiritual direction practice in Williamsburg, Virginia. Unfortunately, I'm without coverage, health and care coverage, and I wanted to share a piece of my story with you today. My partner's employer, my spouse's employer, is willing to cover me. However, because my partner is a woman, I cannot get health coverage through her policy. have several chronic illnesses that can be managed, but unfortunately I can't get independent insurance at an affordable cost because of the fact that I have those pre-existing conditions. When I look at the healthcare industry, I believe that we have a lack of imagination in understanding what family means, a lack of imagination in trying to make healthcare affordable for those who do not have the income to pay for it, and a lack of imagination in trying to understand that having preventive care measures to take care of our people is of utmost importance. Thank you for letting me speak today, and let's make a difference and have public health care.
That wraps up our presentation today, but hopefully everyone within the sound of our voices will call their representatives and senators and let them know that this public needs and wants